So this week we talked about pregnancy and the birthing process. So to begin with, pregnancy is characterized by an offspring being located in the uterus, developing and growing, and typically lasts around 40 weeks, which can then be separated into 3 trimesters, each lasting about 3 months long. The first trimester is when that zygote is formed, fertilization, the blastocyst that implants in the uterine wall, which then becomes the embryo. The second trimester is when that circulatory system starts, the blood starts pumping, internal organs begin to appear, and the external limbs and everything start to grow as well and make an appearance. And then third and final trimester is really when there's a lot of growth of the baby, a lot of weight gain. That skin gets the fatty deposits to prepare for life outside the womb. And then the brain also develops a lot more during this time frame. We also wanted to look a little bit closer at those first 2 weeks after fertilization. So let me get flipped over here. Okay, so here's kind of my diagram. You can see my ovary, fallopian tube, and this is our little oocyte that was just expelled during ovulation, so day 0. Assuming, sperm is present to come meet the oocyte and result in fertilization, we then have a zygote. That zygote will continue to travel down the fallopian tubes, where eventually it'll have its first cleavage. And that is, of course, with the cells multiplying and dividing, so it's splitting. And that continues on again until we have a blastocyst, or skipping a morula stage first, which is the compact ball of cells. And then we have the blastocyst, which is that hollow ball of cells, which will eventually implant into the uterine wall to form the placenta. And that takes us down to that final stage, which is the gastrula stage, which is when that primary layer of the uterine wall is formed and the cell actually attaches to that wall. And this can be broken down into 2 major stages. First one being the embryonic stage, which is from early fertilization all the way to the 8th week of growth of the child. So of course from fertilization, that zygote, blastocyst, all the way to the point that it becomes an embryo. And again, that's the fertilization, the placenta forming, the main internal organs develop, and the external body structures appear. And then from the 8th week on to birth is known as the fetal stage. The offspring is now known as a fetus, and it really just grows very rapidly. The body proportions change a lot during this, and eventually we will turn to birth of the child. So, and then we want to just touch on the areas of postnatal development. So they begin, of course, right after birth of the child. The neonatal development is up until the first 4 weeks. And that is when the baby is learning all the new functions to respire, expire, to eat food, digest it, and of course to excrete feces, urine, everything like that. It is also when the circulatory system is getting used to the outside world and learns how to function appropriately. And then we hit the infant stage, which is from that point until 1 year of age. That is when the muscle and nervous system really matures, and that leads to communication. And also when those first teeth also begin to expel, to make their appearance. And then we have our childhood is from 1 age to puberty. And again, the muscle strength and coordination still continues to develop. Now we have intellect beginning to develop, and those primary teeth we begin to lose, and the secondary teeth then begin to emerge. That takes us to our adolescent stage, which is when puberty hits. So we now have that reproductive function going on. Intellect is continuing to rise, and we also gain emotional maturity as well. Then we enter the adult stage, which we really remain unchanged during that stage. It's also the largest stage out of them all. And then we hit senescence, which is that older age where we start to kind of see the decline in the organs and organ system, the degeneration, and then, of course, we start having some of our problems that might be cardiovascular decline, or maybe some diseases that you might have gotten that eventually leads to death. And then we did want to also talk about the two different methods to deliver. So, of course, we have the normal vaginal delivery, which is when the endocrine system signals those hormones to initiate labor. And the cervix begins to relax and thin to allow passage of the baby. The uterus starts to have contractions, which actually help expel the baby. And then that placenta will detach from the uterine wall, and the contractions will also help deliver that placenta as well. The opposite would be C-sections, which are the surgical incision, and then the doctor actually removes the baby and the placenta as well. Some argue that vaginal deliveries are better because it introduces the babies to the microbiome of the mother's vagina, which aids them later in life, maybe when it comes to allergies and stuff like that. But C-sections are becoming more common, and there are many cases that really do warrant a C-section. I'm one of those mothers. I had my first set was twins, so I had a C-section, of course, and then all my subsequent kids were also C-sectioned as well. And then we also wanted to touch on miscarriage, which is the loss of an zygote embryo prior to 20 weeks. And that can be, or it's typically due to abnormalities in the growing offspring. There's actually a list of over 70 abnormalities, mutations, diseases, genetic problems that can result in a miscarriage. So miscarriages can, yes, occasionally be caused by external problems or the mother's health or nutrition, but typically it's caused by an internal issue. And then we wanted to talk about in vitro fertilization, which is when doctors take the egg and the sperm out of the reproductive system and they actually fertilize them in vitro in glass. And then, so once they fertilize them, we then have that zygote. They'll continue to monitor and culture that zygote for a few days, and then they actually take it and implant it into the uterus for the woman. So just kind of a nice way for couples that are maybe struggling with getting pregnant. This can kind of help them along and aid them. And it's estimated that at least 5 million babies have now been born via in vitro fertilization. And then our final topic we wanted to touch on was actual pregnancy tests to find out if you're pregnant or not. So you can have your labs drawn and then have a blood test, or you can do the typical, what we think of, pee on a pregnancy stick. And what those are looking for is a hormone called HCG. And HCG is actually released or secreted by the zygote or the embryo once it's implanted into the uterine wall. So if you take the test too early and that zygote is still traveling through the fallopian tubes, it won't pick up that pregnancy. So it's important for that zygote to have implanted into the uterine wall, for that HCG to begin to rise and be secreted, and then the pregnancy test can pick up that hormonal changes and notify you that you are in fact expecting. So that is the topic on pregnancy this week. Thank you.